Good afternoon สวัสดีค่ะ It's a little noisy out here. There's some construction around my house and apparently someone just trying to sell something with a lot of honking. Anyway, let's get to it. We are updating you with what's going on concerning the COVID-19 outbreak in Thailand. This is the midday news at 1 p.m. We'll have another one for you at 7 p.m. with me and Nat Budna. But right now you are with Tulip, Naksompop, Blauw. So let's go over the headlines today real quick. We will give you an update of the number of the case recorded today in Thailand and also the Bangkok to propose easing the lockdown restriction and also the drama that has been going on about the Mochana tracing application. We'll go a little informative about that. And also the WEF latest report that said that COVID-19 economic impact are top global threats. And also fact checked the myth buster by WHO. People should not wear masks while exercising. And we will explain why. Now let's go over to the first one. This is the news from the press briefing from the there you go. Today is Dr. Apisamai Srirangsan. That's the one that make the press briefing. So Thailand recorded 59 new COVID-19 cases today with one new fatality. The latest report brings the total cases to 12,653 and total fatalities to 71. The Center for COVID-19 Situation Administration or CCSA reported that there are still 2,961 people receiving treatment, 10 of which are in severe condition, while 9,621 people have already recovered. The fatality was a 48-year-old woman from Tak province. She was a driver for migrant workers in Mesot district. She first developed symptoms in mid-December and was diagnosed with COVID-19 on December 27th. She passed away on the evening of January 18 after she stopped responding to treatment. Dr. Apisamai Srirangsan said that most of the new cases were discovered through proactive screening and are asymptomatic, adding that it is very important for everyone to be aware that if they have been in contact with an infected person or have been in an area that has infections, they should report to the hospital immediately because lately most of the cases we found are asymptomatic or very mild symptoms. So there are 8 imported cases today. All of them are asymptomatic. 2 are from United States, 1 each from Ireland, Pakistan, Malaysia, Japan, India, and Germany. And right now, there are currently 62 provinces experiencing the outbreak, Naksompop being the latest with 1 case. 37 provinces have not recorded a new case in the past 7 days. It means they're doing something right. That is a good news, of course. The 5 provinces with most cases are still the same. Samut Sakhon, Chonburi, Bangkok, Rayong, and Samut Prakan. Dr. Pisamai said that the rate of infection is stabilizing but not falling. So she pleaded with the public not to lose hope after we have been fighting for a year. Now let's go to the next news. The next news is about Bangkok. Bangkok to propose easing lockdown restriction. So we have some footage of the department store in Bangkok. So you not just see my face here. So tomorrow, the Communicable Disease Committee is scheduled to consider a proposal from the Bangkok Metropolitan Administration or BMA to ease lockdown restrictions on certain business and recreational activities. The Deputy Bangkok Governor, Police Lieutenant General Sopon Pisuthiwong, also a director of the CCSA in Bangkok, said that they resolved that the restrictions imposed on business and recreational activities since the middle of December should now be eased, and the resolution will be submitted to the Communicable Disease Committee for finalization. The activities we are talking about here could include fitness clubs, games rooms, internet cafes, banquet facilities, Thai traditional massage, healthcare for the elderly, tattoo parlors, and trading venues for Buddha images. 13 new COVID-19 infections were found in several districts of the capital, including 4 through proactive screening. Most new cases in Bangkok are now catching the virus through contact with the infected rather than from visiting entertainment venues. And that's the reason why they think they should allow all this venue to back to business already. So between December 23rd and Monday, 1,109 people have been giving swab tests, and 20,113 people have been giving saliva tests. So far, 51 cases have been found in the city through proactive screening. So that's the news from Bangkok. Now, let's get to the drama of Mochana app. Okay, let me show you. This is what it looked like. This is what it looked like, Mochana app. And it's one of the tracing application that actually been here before Thailand. It was developed and launched in April last year. And it was just recently promoted by CCSA to use more in the past 1 month or two. So right now it has almost 8 million downloads already with over 6 million registered users. Now, what happened? Mochana volunteer team abruptly announced the government had taken full control of the application, adding that they hope its potential to alert people of COVID-19 risk would be maximized. The application's handover sparked the speculation that authorities were meddling too much in the management of Mochana. Suspicions over government interference were heightened when an independent academy close to the Mochana volunteer team, Loy Chunpong Thong, said that the application would be useless, quote unquote, if the Disease Control Department, which is the government unit, did not use it to provide information on infected people. He said that there is no use labeling an area as red zone. It's a person that is infected, not a place. He make a point. Mochana using GPS, Bluetooth, and QR code technology for speedy contact tracing, which has played a crucial role in curbing the spread of COVID-19. The application uses a red, orange, yellow, and green color code to show user their risk level. So when you use the application, time to time, you should go in there and do a little bit of assessment test. There's about 4 or 5 questions for you to answer, and then they will give you assessment. It also compile with the information where you have been to. That's why it used GPS and Bluetooth. So responding to this open quarrel, many users said that they were abandoning Mochana over concerns about its transparency and efficacy. That is quite concerning too. So what went wrong? When COVID-19 first hit Thailand early last year, expert volunteers offered to help the country pull through this crisis, leveraging their expertise. They won backing from the public and private sectors and came up with the Mochana tracing application, which was launched in April last year. This partnership lasted about 9 months until the government took sole control this month. So, and on January 7th, CCSA was the first time step up efforts to push for the application, and even indicating that it was mandatory and failure to use it could land people in legal trouble. And then they come out later and say that's not going to be a problem, but you just have to make sure you keep yourself a note or something that the official will be able to trace you later if you become infected. Then the Digital Government Development Agency which is tasked with managing Mochana, posted a message on its website calling on people to download the app. So behind the scenes, sources say that the government's approach to managing the app had caused rifts between Mochana's developer, prompting them to pull out of the project. So Mochana updates infection status. The government unit, the one that now in control of Mochana app, is the Digital Economy and Society Ministry. They insist that the application's developers still support the government, and also it provides the latest data on user infection status. At the same time, when they were trying to tell public this, the Disease Control Department Deputy Director General Dr. Preecha Prempri also said that the user's infection status is only changed once a hospital confirms the infection and local officials forward the information to the Digital Economy Ministry and the application's developer. That sounds pretty lengthy and in very detail. The Digital Economy Minister Puttipong Punakan said that the government has taken sole control of the application because of a significant rise in the number of users and because it wants to ensure user privacy is properly protected. So according to the ministry, the application is now linked to the government's data center and cloud service because its original cloud setup came close to being overwhelmed by the number of users. In response to the move, Mochana has stopped asking for personal information during registration, and some features have been removed to ensure privacy is strictly protected. The application now just identifies and alerts people when they visit an area in which infection has been found. Hopefully it still works. It might be a little bit different from it first launched, but it's still one of the tracing apps that would help you remember where you were and help the government identifying you if the person that you, if there is or there was infected person in the same area as you at the same shop at the same time. Now, I don't know if you're going to think I bring only bad news today, but this is the latest news from the World Economic Forum. The economic impact, a top global threat, which is the economic impact from the COVID-19. So they actually going to have the virtual conference this year. This is what they're trying to do because they are also got affected by the COVID-19. The World Economic Forum reported that the world's greatest short-term threats are the loss of life from COVID-19 and related economic effects. The WEF's Global Risk Report is in short name GRPS 2021, based on a survey of 841 people who are part of the WEF stakeholders, communities, including businesses, academia, government, and NGOs. They were questioned in September and October. Unsurprisingly, this year, the COVID-19 pandemic is at the top of the list for short-term threats through climate change, though climate change is still remains among the top long-term concerns. The report said that the immediate human and economic cost of COVID-19 is severe. It threatens to scale back years of progress on reducing poverty and inequality and to further weaken social cohesion and global cooperation. Besides infectious diseases and livelihood crisis, as the top short threats worldwide, the risk of social cohesion erosion due to the pandemic and joblessness was also another critical short-term threat. The report noted that young adults are experiencing their second major global crisis in a decade. And when they said young adult, they said 15 to 24. Having lived through the disruption of the financial crisis and economic inequality, it aggravated. This generation faces serious challenges to their education, economic prospects, and mental health. The report warned of, they call, an age of lost opportunity. Last year, they warned of the lost generation. This year, they warned of an age of lost opportunity, as well as social unrest and political fragmentation. The WEF leaders also noted that the Global Risk Report has been warning of the threat of a pandemic since 2006, which it said highlight the need to find more effective ways to identify and communicate risk to decision makers. The World Economic Forum itself has been also last year disrupted by COVID-19 pandemic, shifting its usual January summit in Davos to May in Singapore, which will be the first gathering of global leaders to discuss how the world can recover from the pandemic since the outbreak of COVID-19 early last year. So we're going to see how it will be like. Now, like I said before, I will try to find some fact-finding, some myth-buster, something from the WHO, some interesting facts for you every day. Today is the question about should people wear masks while exercising. So the WHO said no, people should not wear masks when exercising as masks may reduce the ability to breathe comfortably. Sweat can make the mask become wet more quickly and makes it difficult to breathe and promotes the growth of microorganisms. The important preventive measure during exercise to maintain physical distance and of at least 1 meter from others. I would add to 2 meters from others because if anyone sneezes in 1 meter distance, it might still get to you. I think that's why they try to close a lot of exercise or gym and fitness venue, but you still can go run the park right now, but just to make sure you keep the distance. And that's all the news I have for you in this edition of the news update. Let me see, there is a comment there. Hi to all the viewers. Thank you everyone for watching, and we will get back to you tonight at 7 p.m. Beside the usual COVID-19 update, today we have an editor from VOA Thai language that is in Washington. Then we'll come on the show, phone in or video call with us and talk about what's going on in US, because January 20th, right now it's not 20 in US yet. But when it's come Wednesday, January 20 in US, it will be the day of inauguration of Joe Biden to be the next president of United States. And please don't forget to follow our news on Twitter, on Facebook, and our website, thaipbsworld.com. We will have other news updates to you as well, not just COVID-19. So stay tuned with us and see you again at 7 p.m. with me and Nat Woodnack. สวัสดีค่ะ